All kids get an occasional headache or stomach ache. Think not enough sleep or too much Halloween candy. But when children get them often, they may be signs of anxiety. Stomach aches in the morning before school, headaches when there's a math test on the schedule, butterflies before a birthday party, or even throwing up before a soccer game. These are some examples of physical symptoms that children may experience when they feel anxious. This is especially true with kids who may have trouble identifying or expressing what they're feeling anxious about. The way their anxiety may manifest can be through physical symptoms. First, let's take a look at the physical symptoms of anxiety. Anxiety is associated with a host of physical symptoms, including headaches, nausea, vomiting, and diarrhea, along with a racing heart, shakiness, or sweating. All these physical symptoms are related to the fight or flight response triggered when the brain detects danger. All of these physical symptoms are related to the fight or flight response triggered when the brain detects danger. All of these physical symptoms have a purpose, and when we talk to kids about anxious headaches or stomach aches, it can help to explain the function of these symptoms. For instance, your stomach hurts because your digestive system is shutting down to send blood to other areas of your body. You don't want to be digesting food at that moment because you're trying to either flee danger or fight danger. We often assure children that these physical symptoms are not harmful. They're just their body's emergency system responding to a false alarm. But it's important to understand that kids aren't necessarily inventing their symptoms, and the danger might feel very real to them. So don't assume a child who spends a lot of time in the nurse's office at school is doing it intentionally to get out of class. Their acute anxiety might be causing them real physical discomfort. And headaches and stomach aches related to anxiety are still very real feelings, and we want to take them seriously. It is important to check with your pediatrician. When a child develops a pattern of physical symptoms before school or other potentially stressful moments, experts recommend that you visit your doctor to rule out any medical concerns. But if the child gets a clean bill of health, the next step is to help the child make the connection between their worries and their physical symptoms. So we help them understand in a very child-friendly way that sometimes our body can actually give us clues into what we're feeling. And parents can start by validating their child's experience and reframing it in a more helpful way. So instead of telling your kids that there's nothing wrong with them or nothing to worry about, the goal is to help them connect what they're experiencing to a feeling and label it, so that the next time their stomach hurts, they can stop and say, "Yes, my stomach hurts, and oh yeah, that's because I'm feeling worried." And it can also help for kids to learn some different skills to calm and relax their bodies, which can also help them feel a greater sense of control. So now let's talk about what parents can do to help. First, don't let kids avoid things that they're afraid of. It can be really tempting when children are complaining of a headache or a stomach ache to let them stay home from school or skip the party or the game that they're feeling worried about. But avoidance actually reinforces the anxiety. Because if we're allowing them to avoid it, then they're not able to learn that they can tolerate it. And we want to send kids the message that we're confident that they'll be able to cope through it, even if it feels hard and uncomfortable. Second, we want to avoid asking children leading questions like, "Are you feeling worried about the math test?" Instead, questions should be open-ended to avoid suggesting that you expect them to be anxious. For example, you can ask, "How are you feeling about that math test coming up?" If the problems your child is having are disrupting their ability to go to school consistently or concentrate at school, participate in activities, or socialize with peers, it's possible that they may be developing an anxiety disorder, and it can be helpful to consult with a mental health professional. The gold standard treatment for anxiety disorders is cognitive behavioral therapy, or CBT. CBT helps kids better understand their anxiety symptoms and learn skills to manage it. Next, we'll look at techniques for calming down. These are some of the techniques clinicians teach anxious children and are adapted from CBT and mindfulness training. Deep breathing. Drawing in air by expanding the belly, sometimes called belly breathing, helps kids relax by slowing breathing and reducing their heart rate, blood pressure, and stress hormones. This can also help relax tense stomach muscles. Mindfulness exercises. Techniques such as focusing on what's around them, what they see, what they hear, can help pull children away from their anxiety and ground them into the present moment. Coping statements. This is where children are taught to talk back to their worries. They can say, "I'm feeling scared and I can handle it," or even something along the lines of, "I'm bigger than my anxiety." Coping ahead. Children are taught that when you have to do something that makes you nervous, it helps to anticipate that you might have some discomfort and plan what you can do to counteract it, knowing that when you push through it, it can get easier. Acceptance. This involves acknowledging the discomfort without fighting it. So instead of trying to push the feeling away and get rid of it, we ask you to hold on to it and tolerate it so that you can get through it. The parent's role is key. It's only natural that parents don't want to see their kids in distress or make them go to school when they're worried that they'll throw up. This puts parents in a really difficult spot. What we hear from parents is we just let them stay home one day, and then one day led to 3 months. Letting our kids stay home one day because they're feeling anxious may be a slippery slope that can lead to their child asking more and more to stay home. So we work with parents a lot around how to find that balance between enabling anxiety and meeting a child where they are. And we also give them statements that they can use to be empathic and encouraging at the same time. For instance, "I know that this is really hard and you feel really sick, and we also know that this is anxiety and that you can get through it." Sometimes setting up a reward system can help by giving a lot of positive reinforcement for kids pushing through their anxiety. Parents also face the challenge of tolerating their own anxiety about pushing a child who says they're ill or worried about vomiting. If your child is in distress and talking about not wanting to go to school or feeling sick or thinking they might throw up, then you as a parent might also feel really anxious about that happening. Finally, let's talk about working with the school. The school plays a really important role when kids develop physical symptoms of anxiety. Clinicians often work with the school nurse and sometimes the psychologist or counselor to set up a protocol for keeping the child's absences from class as short as possible. For instance, the recommended amount of time to wait before encouraging the child to go back to class might be as short as 5 minutes. As much as we can, we urge them not to contact their parents or send their child home if they're saying that they're nauseous, if we know that they're feeling this way because they're feeling anxious. The shorter the break can be, the better it is, because the longer they're out of the thing that's making them feel anxious, the harder it can be for them to return. Thanks for joining me for this video. I'm Amanda Greenspan, a clinical social worker at the Child Mind Institute. To learn more about anxiety disorders, visit childmind.org/anxiety support. There you'll find everything you need to know about anxiety treatment at the Child Mind Institute, plus hundreds of articles and guides to help you support children who are struggling with mental health, behavior, or learning challenges.